Hi, this is Sam. Hope you are doing well today. Um, I want to make a video today basically on something that kind of just came up uh, roughly maybe about a year ago. And basically, it's been causing more and more issues as I go. And it is part of the autoimmune system that is causing the issues. And that is the eye inflammation. Um, it's something called the uveitis. Basically, it's inflammation of the middle layer of the eye. And when it inflates, um, I get red eyes, irritations, pain, uh, blurriness. You see little things floating around in the eyes, and it's getting to the point that where my doctors are getting concerned at the moment. So um, I want to cover that because basically that's something. The condition is not new. However, the additional medication or treatment that my doctor gave me is new. So let me just get a little bit of the disclaimer in. My name is Sam. I'm not a doctor and I don't have any medical experience or education. Um, Basically, everything I talked about is my own medical experience. Everything that's happening to me, all the treatments that's been used on me and myself only. So if you have any medical questions or any sort of um answers that needs to be addressed, please contact your doctors or your pharmacist for advice. Thank you. So the eye inflammation, like I said, it came up more and more frequently as of maybe just slightly a little less than a year ago in the middle of 2022. Um, I do have an ophthalmologist for the last few decades, which I normally go visit him every 6 months or every 9 months just to get a follow up to make sure nothing's happening. But the last year or so, um, I've been going to see my ophthalmologist about maybe once in every 2 months. If it's not once in a month, where there are some flare ups. Um, However, during the period of time when I went to see my doctor, um, there was only two times we actually saw major inflammations. The other time it might be, just irritations, such as allergies or other stuff that can cause it. But it is irritating enough that I'm getting red eyes. Uh, I see floaters around, and it very well could be an inflammation. It might just not show on the when I went to get the scan. So basically, this is part of your immune system, and the autoimmune disease is just a horrible thing. Um, and for particularly for people who have inflammatory disease such as ankylosing spondylitis, like many of us, and arthritis, again, um, also IBS, inflammatory bowel disease, Crohn's disease, all these inflammatory um, diseases is caused by the autoimmune system, and it is affecting my eye recently. So again, many of these conditions you can find. There's more conditions like this you can find on the website. It's very accessible. Um, some of the viruses, if you actually get catch some of the viruses like herpes, other STDs can also affect the eye as well. But basically, for many of us who already have inflammatory disease, it's very notorious that it does affect the eye, and I don't hope that many of you have it. But right now I am having this particular issue right now. So if you look at the eye here, again, this is what my eye really looks like. This is not mine; it's just a picture. The normal eye is on the right side. This is normal. This is not normal. So yeah, this is what I'm getting, and irritations um, on either the top, the bottom, or the right side. It could happen on any side of the eye. Luckily, my whole eye have not been completely red. So, and but it doesn't mean it's a good thing, of course. So again, it comes on very quickly, and it's not like you can feel a little bit of the irritation, and then it'll go on days and days. Once you feel the irritation, it's basically already there. Once you wake up from, once I wake up from the in the morning, um, I can feel my eye is having issues. Um, but generally, what I do is I kind of just use some of the artificial tears um, to see if that can actually remove it, or uh, or kind of feel make the eyes feel better. And if that's the case, I also have other drops like red eyes and all that. If that's the case, then it might not be inflammation. It might just be some weather, allergy, the air, whatever conditions that can cause these particular issues. But if it doesn't, when I know if it doesn't remove it in the next day or so, and it doesn't make me feel any better, definitely, most likely, my eyes start inflating. So, um, looking at this picture, the eyeballs, it's an inflammation of the middle layer. Basically, it's like the this part of the eye here. I don't know enough about it, but I know my eye is having an issue. So, uh, again, last middle of last year or so, that's when I start having issues. The first time when I went to see my doctor, um, he did see the inflammation, so he did say it's uveitis, and he explained it to me that people who has these ankylosing spondylitis, autoimmune disease is very notorious for. That's why I have a doctor, the ophthalmologist for many years, many years. Never had a flare up, but I did have flare ups from here and there due to other issues, and it's once it's gone, it's when it's gone. But this, um, when it's gone, uh, I need the doctors gave me the anti-inflammatory eye drops, prednisones, um, and there was another one I don't remember the name. These eye drops, what they told me to start off with is when it's inflated, I need to start off with 4 times a day, possibly for a week. Uh, 4 times one drop for a week, and as you know, prednisones you need to taper off. You can't just uh, stop it. Once you stop it, the inflammation can come back much worse. So, and then the next week, I can go to maybe 2 drops a day. I probably don't need the 3 drops. 2 drops a day for maybe uh, for a few days, and then I go to like 1 drop. So if it all gets better, I can go to 1 drop for maybe about 3 4 days, and then I can just stop it from there. But you cannot just taper off. Just I mean, you cannot just stop it. You need to taper off just like that. So again, here's what I was just referring to. Um, the prednisone drops. If my doctor said if it's bad enough, it doesn't do that, then prednisone pills will be prescribed. But at this particular moment, um, I have shipped over to, the USC Rusky Eye Center. Um, Very good doctors over there. A lot of newer technology where they can actually see the whole eye, even inside of it, with the machine mapping the eye, make sure nothing is damaged inside as well as the middle layer and the outer layer, and as well as the cornea itself. Because I see floaters, you can basically see these little um, like dust or clouds or fuzzy things just floating around as your eyeball moves. It travels with you, so that is a particular issue. Now, my ophthalmologist prescribed me with the prednisone drops, but the main treatment is really uh, lies on my rheumatologist because it's an inflammatory disease, part of the autoimmune these issues. So I am already on biologics. Currently, I am on Cimzia, and I'll cover the biologics on another video because I have gone through a few of them and the effects of it. So, but she gave me a new medication called Cellcept, uh, also called I can't pronounce it, microphenolate, something like that. It's a medication that is used mainly for people who have transplants. And I guess a medication, what it really does is that it it also is a autoimmune suppressant, so it lowers the immune system, so it doesn't fight the the external transplant part in the body. So, but the doctor said this is also an immunosuppressant. Um, it works well with the biologics. I asked her, should I be changing biologics? But she said, let's not do that right now. She said, let's try this particular medication, uh, which also gets me a little bit concerning because right now I have two different immunosuppressant. Um, I am a little bit anxious or worried about taking this medication, but I did start taking it. And what you're saying that I need to get blood tests once a month just to make sure that the white blood cell, the autoimmune, I mean not the autoimmune, the immune system does not drop too low and where to the part that where my body cannot fight anything at all. That's bad. Also, the other side effect of this particular medication is, again, it will weaken your immune system more if you're already taking biologics. Nauseous, vomiting, not something I'm very concerned about because I have many particular medication that does that anyway. I, I feel nauseous and pretty much all the time. Uh, Diarrhea and cramps. She said this medication will actually does that, but when it is persistent, if I have these cramps and diarrhea and persistent, then that means it is doing too much. My immune system is too low, then I have to stop the medication. If it comes and then it'll get a little better, then it's fine. Now I just start taking this medication one day. This is my second day. Yesterday, the first day, I did not felt much. Uh, Today, this morning, I felt a little bit on my stomach that I'm feeling some uh, discomfort, so to speak. Not diarrhea yet, so we'll just have to see how this is gonna go in the next few days. Um, she also mentioned that I need to get make sure I need to keep an eye on my if I do get a virus, I do catch a cold or flu, COVID, bacteria and all other stuff. I need to be alert, and if it's necessary, I need to get treatment for it because the immune system has been suppressed twice. How great is that with the two different medications? The medication, my pharmacist also warned me about monitoring my blood pressures. This medication can also brings up blood pressure. Oh, so great! Oh my God! And I'm saying this as a as a joke. Um, Recently, my blood pressure has been on the upside. It's been more like 150 over 95, 96, 97, 98. So it has already been on the high side. And I already talked to my other doctor getting a second medication to help me lower my blood pressure a little bit. So, but this medication will also raise my blood pressure. And I was just like, oh my goodness, that is just so great, so awful. I mean, I really don't know if I should take it or I should not. But I think at this moment my eye is needs to be controlled. We'll see how that is, and the blood pressure. I'll just keep monitoring it. If it's spiked even higher, then I have to talk to my doctors and maybe get more medications for it. But it's an ongoing thing. More and more medication, you find one thing to fix you, and then but it actually does more damage to other stuff. Unfortunately, that's how it's gonna go. So, she also mentioned that it actually can interact with a lot of the medications. I do have a GERD as well, so I take acid reflux medications, and I need to separate gout. I need to kind of give it a couple of hours in between. Now, generally, I normally take these medication, the acid reflux medication in the morning because it needs to be taken on an empty stomach. This medication also needs to be taken on an empty stomach. It needs to be taken 1 hour before food or a couple of hours after that. That's what I was told by the pharmacist, and particularly with the acid medication, um, it's going to cause issues, or it's going to reduce the effects on it. So it needs to be separated out. Um, Also, I read something about this particular medication for women's. Um, if you should not be on this medication if you're going to get pregnant. This can cause pregnancy issues. So please look up this medication if you are intended to take this or your doctor prescribe it to you. Um, but again, this medication is brand new to me. Every time when I have medications, I get very anxious about taking it because I'm very sensitive to medication. Even the lowest dose would cause issues, and I get really, really uncomfortable. My body just doesn't like it if the medication doesn't work out. But so far, for the first day, it's been fine. I am not getting any so-called particular effect on it yet. We'll see how it is. Um, and my doctor said if it works out well, then in 1 month, I need to increase that to. Right now, I'm taking it one pill twice a day. Um, and once if it feels good, then I will need to move up to two pills uh, twice a day. So that could be more concerning. The more I take, the more immune system is going to be suppressed. So again, doubling on my immune suppression. Um, I am a little concerned. Um, let's really hope for the best right now. It's all I can do. Um, well, I have to monitor my, make sure I'm not getting any diarrheas or persistent side effects. And if I am, then I need to let my doctors know and possibly stop it. Um, Not sure anybody else is affected by the uveitis. Hopefully not. Um, and if you are, how are you dealing with it? Please let me know because right now I'm pretty new to this particular um, inflammation on the eye right now. On a long term basis, I don't want to go blind. Of course, nobody wants to. So how are you dealing with? Are you just dealing with the prednisone drops? You on other medication that works out for you? Um, Let me know. See if you can leave me a message, and hopefully see if I can learn from you on this particular subject. So that's all for the video. It's basically I just want to talk about this is something new, but I have something else. I have a lot of other issues that um, it's not going to be able to cover in one video. So I want to see if I'll break these apart one by one. So again, this is all for this particular video. Um, Thank you for watching. If you do like what I do, please give me a like. It helps out with the algorithm, and subscribe. I'll have other uh, conditions and things planned uh, to do on the video. So hopefully we can all kind of share information and we all find a better day. And thank you for watching. Take care. Bye bye.